Hello everyone, in this video we are going to discuss about Helicobacter pylori. So this is a gram-negative curved or spiral rod which is motile in nature because the motility is because of the flagella. It have multiple polar flagella, also called as lopotrichus. As we can see in this picture, it is a flagellated organism which helps in its motility. So it is also micro-aerophilic. Micro means a little, aerophilic means oxygen needing, so it needs only a reduced amount of oxygen, and it is also catalase positive, oxidase positive and urease positive. This urease positivity, urease positive means it will convert the urea into ammonia. So the ammonia is a base, so it will alkalize the microenvironment. So coming to the transmission, this Helicobacter pylori will be transmitted by fecal-oral route, oral-oral route, or via contaminated water or food. So human stomach is the primary reservoir. So coming to the virulence factor, why this organism will cause the disease. So the main thing is urease. So the urea will be converted to ammonia by this urease enzyme. So this ammonia, as it is a base, it will neutralize the stomach acid. So stomach acid, it is a protective phenomena. So since it is alkalizing it and it is neutralizing it, so this protection is lost. So that's why it causes disease. Next is flagella. This flagella helps in motility in the mucus and adhescence. So this adhescence will helps the organism to bind to the gastric epithelium. And next, the virulence factor is CagA. CagA stands for cytotoxin associated gene A. It will disrupt the cell signaling. So it is very important because it will help in the inflammation process and also increases the risk of cancer. So this CagA is an important virulence factor of this Helicobacter pylori. And next is VacA. It is vacuolating cytotoxin. It causes epithelial injury, and also all these will cause chronic inflammation and finally the mucosal damage. So coming to the diseases associated with this condition. So this Helicobacter pylori will cause chronic gastritis, either it is antrum predominant or pan-gastritis, and peptic ulcer disease, which is duodenal peptic ulcer disease, is more common than gastric peptic ulcer disease, and gastric adenocarcinoma, gastric adenocarcinoma and malt lymphoma. Malt lymphoma may regress after eradication of this organism. Coming to the diagnosis. The diagnosis can be in the form of both non-invasive and invasive forms. Non-invasive diagnostic tests are urea breath test, stool antigen test. Coming to the serology, which can be done for the past infection and less useful for the active infection. Coming to the invasive diagnostic test, that is rapid urease test, that is CLO test, and histology wise Wathin-Starry silver stain and GIMSA stain. So, and also here we can see in this picture histology showing Wathin-Starry silver stain, where we can see black colored organism which is Helicobacter pylori, and the culture is rarely done. So coming to the treatment, there are two methods of treatment, that is classic triple therapy, which is given for 14 days, and quadruple therapy. So classic triple therapy, as the name suggests, is to have 3 drugs. PPI, that is proton pump inhibitors, along with clarithromycin and amoxicillin, or metronidazole can be given if the person is penicillin allergic. So these 3 drugs are given for 14 days. The next type of therapy is quadruple therapy. If the clarithromycin resistance is seen, as in triple therapy, we can give proton pump inhibitors with bismuth, with tetracycline and metronidazole. So these are the important points in Helicobacter pylori.